I am Timothy Patterson with Changing Tides Counseling out of Biloxi. I'm also a hospice volunteer with Arden Hospice, and I go around with my dog Titus, who is a trained therapy dog, and we do pet therapy for hospice patients if they request it. So I'm pretty sure if you're watching this video today that you're probably either have someone you're fixing to lose someone, or you have a loved one that's fixing to lose someone, and they're fixing to go through the grieving process. And I know it's a difficult process to go through, so sometimes having as much information as possible can help make it easier. So you might say, well, what is complex or complicated grief, or what they call prolonged grief disorder? What it really is for an adult is when you go beyond 12 months, around 12 months or after, and you're still having trouble moving beyond some stages of the grieving process. For children, it's beyond 6 months. So we all go through a grieving process. It's all unique to each one of us, but sometimes we have trouble just moving through the grieving phases and getting on to that point of our life where we can go on and have a healthy life and cope with the fact that we've lost a loved one. So sometimes it's, you see a persistent preoccupation, a year later, and all they really talk about is their loved one and the loss or the pain they feel. A lot of times difficulty accepting the loss, just really, it can show up as anger. They may get angry at the person that they lost. They may get angry at other people who haven't had the loss that they had. I mean, there's a lot of ways that grieving process happens and goes through. They lose interest in things that they normally are interested in. Sometimes they'll stop taking good care of themselves. Sometimes they feel bad and they blame themselves and stuff. So it's kind of one of those things where some of these things we go through, even in normal grieving to a point, but you can tell when it becomes an unhealthy thing for the person or for those around them. And especially when you hit around that 12-month point or 6 month for children, they definitely probably need to get a counselor or therapist or someone to try to get them some help. So kind of understanding the process that some people are more susceptible to complex grief. If it was a sudden loss, let's say someone had all these plans for retirement, they have all these plans for their life, and then boom, the person gets diagnosed with something and very quickly pass away, then there's just a huge amount of their whole life, dreams, plans, everything that just have to be shifted. And sometimes that just is very difficult, and it can make you more likely to struggle possibly with complex grief. The other one is just lack of social support. Sometimes you have a couple living and maybe when that person passes, the other person doesn't really have anybody. They don't have any children, they don't have family. And so that could make it difficult for them. The multiple losses. Sometimes people will lose both parents within, a fairly short period of time, or a parent and then a loved one, so those things kind of can stack on each other and can overwhelm the person. And then they fall into depression, and then they just really have trouble moving forward. They'll lose interest in things that they normally enjoy, and they'll, if they got a history of trauma, depression, things like that, mental illness, that can make them more susceptible, along with just if they just have a real strong dependency. That's like we talked about. Sometimes people kind of build their world around their loved one. And, when they lose that loved one, it's a devastating thing. So in those situations, if you are a loved one of that person, or you're a caregiver, or you're someone that's concerned, making yourself available, helping them out socially, it's just a really good thing you can do. Now, to help them with healing, a lot of times you have to help them do things that are good for them, things that they might not, getting them to a support group or getting them to go see a therapist. That can be a very helpful thing. Not only knowing that it will help them, but them sharing their story will help other people, because there's other people sitting in the group that have experienced similar things to what you have. They might be at different stages of grief, and that can really help you to realize you're not the only one struggling with this, and that other people are struggling with it. And there might even be people in the group struggling worse than what you are, so, and that can help, community connections, if you're, finding hospice volunteers or people that will go over and sit with someone that is kind of isolated, that don't have the natural social support that you would like them to have, that can help them get through the grieving process, and in a healthy way. Routines and structure. getting up and having something that you're looking forward to doing or that you need to do that gets you up and gets you moving and gets you to thinking about something other than your loss, other than your grieving, stops you from ruminating over the past, which we really can't, we can't change. And, but that is a healthy thing. If you've got a friend in the neighborhood and, say, go by and say, hey, let's go for a walk every morning at 8 o'clock, or let's do this, something that gets them up, or let's have a cup of coffee, or let's meet down at so and so. That can be a very helpful thing to help them to get out of that rut they're in the grieving process and help them move forward. It gives them something to get up and look forward to. I'm not, sometimes they're laying in bed thinking, why should I get out of bed? What do I need? And sometimes being able, to meet somebody and interact a little bit or knowing somebody's relying on them can make a difference. Journaling, some people draw, some people paint, some people just write stories. I've had a couple clients that write poems or short stories are just really good about different things. Very therapeutic, very helpful. Even writing letters and where you express the things that you feel for the loved one, even some anger or frustration or maybe just love or how you miss them. And then you can mail the letter or sometimes you can, you know, I've seen people that love the ocean and they would take and put it on a little balloon with a little fire thing underneath it, and it just kind of floats out over the ocean and goes away. Or I've seen others that'll build a little fire and they just sit out there and put it in the fire and just let it burn. The person that you're communicating with knows what you're saying. But it's a process of being able to express those feelings that you have that might be keeping you stuck in the grieving process at a certain phase. Um, Another part of it is just being self-compassionate, which means kind of cut yourself some slack. It's okay. When you go through the grieving process, it is going to be difficult. It's okay that you get a little depressed. It's okay that you struggle with doing some things, or maybe you aren't doing things right at quite as well right now as you normally would. You'll get back to where you need to be. You just have to, don't beat yourself up over it. Here's some good reminders that can help you. Grief has no timeline. We grieve the loss of someone really forever. What grieving really means is we learn how to cope with a life without that loved one. Now, normally our loved one would love for us to be able to have a happy life and cope with it in a healthy way. No loved one normally wants us to be miserable and just, they really do want us to be able to move on in a healthy way and live our life and in a way. So you can honor the person fully and still have a good life and still enjoy life. Like I have people that will do Thanksgiving or Christmas, and instead of making it this, oh, this is our first Christmas or first Thanksgiving, they actually make it a celebration of their life, and they actually talk about some funny things that happened in past Thanksgivings or past Christmases. And there'll be some sad parts to it, but you also share a lot of the funny stories or the favorite foods or this and that, you can make it a more positive celebration of life. It's okay to seek help if you're grieving, if you're struggling. It's good to have somebody you can just call if you're having a really rough night, and just talk to. Progress can be slow, but you have to take small victories. The fact that you got up today and brushed your teeth and brushed your hair, that might be a victory. The fact that you went out and got groceries, that's a victory. The fact that you went to church again, that's a victory. Or the fact that you reached out to a friend, or you answered some text messages that people have been sending you that you've been, not wanting to answer to. A lot of times when these things happen, people are all around you when you're going through the process of them being sick, and then you lose them, and then all of a sudden you're 3-4 weeks after it, and all of a sudden you find yourself by yourself, or you just get to the point where it's really sunk in on you. You've really accepted that they're gone, and then it can be difficult. And then sometimes we try to isolate. So we have to try to avoid those things. And if you have a loved one that you're trying to help and support, don't let them isolate. Go out there and try to get them and take them out to get a bite to eat, or go do things they enjoy, or bring something over and hang out with them, have a cup of coffee with them in the morning. Just be a sympathetic ear. And they might even express anger. They might this and that. Just understand they're needing to kind of work their way through their grieving process. There are some tools that I can give you if you feel like you're having complex grief or complicated grief. It really helps with any grief. And a lot of that is just like some grounding exercises, which is where you can go and sit outside and see what you can see and just kind of notice 4 or 5 things that you see. You're sitting on your front porch and you can see a squirrel playing in the tree, and you can see acorns, and you can see a bird, and and then you can hear the chatter of this, and you can hear the wind blowing through the trees, and then the smells that you can smell, and then the feelings that you feel. You can feel the cool breeze, or you can feel the step that you're sitting on, or the chair you're rocking in. And then even, the taste of the coffee you're drinking, or the cold water you got, or some iced tea, or, a little snack that you're having, that kind of stuff. So those are all grounding type things. When you think about those things, it kind of gets you out of your head. An exercise that I use pretty often is what I call calming place. So you literally close your eyes and you imagine you're at the most beautiful, calming, and relaxing place you've ever been at, or you've read about, or you've seen on TV or a movie. And in your calming place, you control everything. So let's say it's the beach. About 75% of my clients go to the beach, and they sit there and they imagine they got their eyes closed, and they imagine the waves, and they imagine, let's say, the pelicans swimming over the water, maybe diving down after a fish, porpoises out there popping up, and pot of porpoises, they see the waves, they see the sand, they can hear the birds, hear the splash of the water, hear the waves, hear kids playing. They can smell the suntan lotion, they can smell the water, and they can smell somebody cooking down the thing, touch. I mean, they can touch the sand. Let's say they're walking along the kind of that wet sand, that's right there, right next to where the water is, in there between their toes, and they can feel the breeze blowing, Then they have their favorite snack or drink, and but you kind of go through all 5 senses. Very grounding, very relaxing. Your brain can only be on one neural pathway at a time. And if you're on a calming, relaxing neural pathway, you're not focusing on your loss. You're not focusing on your pain and your struggle. And then whenever you come out of your calming path, you can choose to go where you want to go. You don't have to go back to where you've been stressing and everything over. You could go on and decide, I'm going to go outside and go for a walk and walk the dog, or I'm going to call my friend or something. It helps to get you when you're stuck on that neural pathway that's causing you a lot of stress and anxiety. So, like I say, journaling is very good. Physical activity, getting out, moving around, working the flower beds, going for a walk, going to the gym, all those things are all very healthy. Mindfulness, which is really relaxing, calming, praying, reading, all those kind of things. Connections, even sitting down with family members or friends and talking about different stories, different things. And, you know, a lot of times, if you go through my experience is a lot of clients that have a prolonged illness where they're taking care of a bed bound or taking care of someone, a lot of times they start their grieving process, and even a complex grieving process, even before their loved one passes away, because they already know that the person's going to pass away. So they begin to go through. So you might even see them going through some grieving processes, even some complex grieving processes, even before their loved one has passed away. Where you may see them be angry, or you may see them be depressed, or you may see them, kind of just almost like they're in shock, where they're just going through the grieving process. And sometimes being that ear to listen to them. It's a time when they need love, and they need patience, and they need compassion. And even if we're trying to move them from something that's unhealthy, we want to do it in a loving and caring way. This is not the time to treat them like toddlers and scold them and tell them to suck it up and move forward. This is the time to sometimes try to help them move forward and just try to listen. And if you are trying to encourage or guide, just remember you want to do it with a loving heart. Sometimes these loved ones will be elderly, and sometimes they'll be struggling with a little bit of dementia. They might be a little confused, but they're still an adult. They still want to be loved and respected. And a lot of times that can make them much easier to work with and deal with. And you can influence their behavior a lot more if you're doing it with a loving heart, and you're doing it, kind of with the right direction. So if you have any questions, if you're any struggling, along the way through this process, then it's easy to get them help. There's therapists, there's support groups, there's all kind of things out there. Being in hospice care with Ardent Health, you've got chaplains, you've got social workers, you've got compassionate nurses, you've got compassionate aides. And if you're really struggling or having issues, even after your loved one is, it's 4 or 5 months afterwards, you can reach out to your chaplain, or you reach out to Ardent Health, and they will try to get you help. Maybe it's having an Arden Health hospice volunteer come by and visit with you pretty regularly, someone that lives close to you that really enjoys coming over and being a part of that social structure. There's lots of things available. Don't isolate and don't, cut yourself off from the things out there that could help you. And just remember, if anything's dangerous or acute or anything like that, there's plenty of therapists like myself out there that would love to help you and would love to be a part of your life and make a difference. Okay. For Arden Hospice, as a volunteer, I'm Tim Patterson, and with Changing Tides Counseling out of Biloxi, and look forward to seeing you again under better circumstances. Thank you. Bye.